Hi, I'm Aaron, the founder and CEO at Vital, and this is a brief overview of ERAdvisor. ERAdvisor is software that sits on top of your EHR to improve patient experience without doctors and nurses having to do a thing. It's serving about 1 million patients a year across 20 health systems with great results. We've seen big improvements in HCAP scores, 60% decreases in left without being seen across multiple health systems. We've seen Google review ratings go from 1.7, 2.3 stars up to 4 stars and over online. And we've increased the rate of follow-up appointments after the ED to the point where it's worth about $1 million per year for your average sized emergency department that implements ERAdvisor. Let's take a look at how it works. The patient walks into the ED and registers exactly the same way that they do today. There's no change on your side. Vital is sitting on top of Cerner, Epic, Allscripts, Meditech, and sees a new visit. And so they're going to invite the patient using a text message. So welcome to your hospital. Here's a special secure link. It looks like a password reset link. And it means that you don't have any app download. This is a progressive web app. Confirm your name and date of birth, and that's it. Works very, very easily. It's one of the reasons why we have exceptionally high adoption of about 60% of all patients using this, and I've seen 70-75% in pediatric hospitals. Immediately, you're going to see AI-powered wait times for each step in the journey. So the first one is, how long is it going to be before you see a triage nurse? These wait times change hour by hour, day by day, and in fact, patient by patient. So you have two people who walk in at the same time, one elderly with chest pain, the other one young with an ankle sprain. They're going to see two different wait times. This is all co-branded to look like your hospital. It's going to be loaded with pinch and zoom maps. You're going to be able to see how busy it is and what's coming up after triage. It'll move forward automatically as soon as it sees a triage note being written. At this point, the patient is still waiting in the waiting room, 30 minutes to an hour. These wait times are about 90% accurate, and we always err on showing patients a little bit more than what we think will occur. You can also share your visit with family members. Hugely important, particularly in the pediatric case. It was also very useful in the pandemic and is still widely used. There's a share link, or you can click on a few family members. It'll compose a text message, and they get a no PHI single-page version of your visit. My brother's going to be in the ED for another 2 or 3 hours. He's waiting on 3 lab results. Here's who the attending physician is. Here's where I need to pick him up, in 45 minutes. So it helps with the discharge process as well. If a patient has been waiting for too long, we try to treat them like a real human. We're sorry you're still waiting. It's our goal to get you treatment as soon as possible. So we can program these automatic text messages or apologies at 90 minutes, another one, if you've been waiting for 2.5 hours. Different hospitals will customize these to offer water and blankets, depending upon if you have the staff to do so. Eventually, you'll be seen by your care team. Your labs will get started. We make it a point to show lab results in a way that people can really understand. Your average person doesn't know what BUN is, and so we say it tests your kidney function, or this one can tell if you're dehydrated. Eventually, at the end of your stay, you'll get a nice discharge document. It'll parse your discharge paperwork and show you the impression of what the doctor thought you have, and it'll actually do an AI summary and translate doctor speak into something that you can truly understand. It'll show you that this person was diagnosed with a hip fracture. It'll show you videos. You can see all of your videos over here in the Learn section. These are automatically assigned to a patient based on what we see in notes, ICD, and CPT codes. And then it'll give you a list of what you need to do after your stay. Book a follow-up appointment. Sign up for the patient portal. Rate your ER experience. That's where we get great ratings from. Share this with loved ones. and then a nice, easy summary. If patients don't book follow-up inside the app right then and there, that's okay. We're going to remind them with a text message a couple of times. This is why we see great ROI. The system is automatic. You don't have to do a thing. It's got surveys in there if you'd like, service requests if you have the staff for it, but you can just sort of set it and forget it and get better patient experience scores. Thanks.